Just a reminder, we are recording the meeting today, just for our record keeping purposes. Got a couple more folks in the waiting room. Just gonna kill some time while they are dwindling in. In the meantime, we'll start with the folks in the room, but if everybody would like to go around and introduce themselves and maybe say your name and the agency you represent, that would be super helpful. So.
Stephen Wilson, citizen of Mecklenburg County, member of the local recovery community.
Catherine Maloney, Tri-County Community Action Agency, a nonprofit out of Halifax, Virginia.
And I'm Beth Chestnut. I'm retired, working in the community, doing a lot of volunteer work, and just here to learn more information.
Great, thank you for doing it.
Ian Dyer-Smith, physical agent for Southside Wellness Coalition, as well as the director of prevention for Southside Behavioral Health.
All right, thank you. And I'm William Hudson. I am the chair of the Southside Wellness Coalition and the co-founder and CEO of Lean In Project. Let's see, the first person I see is Elena. So I'll popcorn it to you and then you can popcorn it to somebody else.
Good morning. I'm Sherry Elena Martin. I am a housing case manager at Tri-County. I'm also on the leadership for the Southside Wellness Coalition, and I'm going to pass it to Tiffany.
Hey, good morning, everybody. I'm Tiffany Leith, the treatment placement specialist with Acadia Healthcare. Oh, I'm supposed to send it to somebody. I'll go with Shelly Clary. That's the next person I see beside me.
Good morning. My name is Shelly, and I'm the education specialist at the Virginia Poison Center at VCU Health in Richmond. I will pass it to Allison.
I'm Allison Byrne, and I am the Community Engagement and Partnerships Coordinator at the VA in Richmond. And I will pass it to Jeanette.
Good morning. I'm the community health worker with Brunswick Health Ambassadors, serving Brunswick County and also working in conjunction with Danville Pitt Health Department. Good morning. I'll pass it to, I don't know who didn't go. Cheryl, did you go? Cheryl?
No, thank you. My name is Cheryl Parrish. I am with Victim Services Unit with the Virginia Department of Corrections. And I will pass to Tiffany's been, Sherry, Allison, Keenan. She's already been. Let's see. How about Natasha?
Hello, good morning. My name is Natasha Lipscomb. I'm with the Southside Virginia Area Health Education Center, AHEC, here at the Southern Virginia Higher Education Center, and I will pass it to, I think it was Dr. Jacqueline.
Yes, good morning. My name is Dr. Jacqueline Barnett. I'm the owner and operator of the Rising Development Center. I do individual therapy, group therapy, for adolescents and adults in the Mecklenburg and surrounding areas. Thank you.
All right,
I will pass it to who hasn't went? Elizabeth. Elizabeth? Or you can go ahead.
Okay. I'm Shannon Simpson. I'm with the COPE project with Virginia Tech.
I'll go next. I'm Angela Jameson. I'm the other community engagement and partnerships coordinator with the Richmond VA, but I'm in Fredericksburg. Thanks. And I know Elizabeth jumped on. I don't know if she's ready to introduce herself. And I don't know, did Everett go yet?
Happy to jump in. Everett, I'm with Community Housing Partners, Energy Solutions, based in Harrisonburg. And I'll just let whoever wants to chime in who hasn't introduced themselves, go ahead.
All right, Elizabeth, I just asked you to unmute, see if that changes your permission at all, but I'm sorry about that.
She could ask them to drop their titles, what agency they represent in the chat box.
Okay,
That'd
thank
be
you.
great.
And everybody, just for record keeping purposes for the folks online, if you wouldn't mind just putting your name and your agency that you're representing in the chat box, so that we can document those in our notes, that'd be really helpful. Thank you. Sorry about that, Elizabeth. I'm not sure why it's not letting you unmute, but good morning and welcome. I'm glad you're here. Also for folks who want to engage but maybe don't want to come off mute, feel free to put it in the chat too. I'll definitely be monitoring that as we go. So before we get started with this week's agenda, I want to make sure that you all have an opportunity to see and approve our meeting notes from last week. I'm going to put them on the screen for just a second, scroll down, give you all a couple of seconds to review them. If anybody has questions or comments, feel free to come off mute or put them in the chat, and then otherwise we'll call for approval.
And you guys,
Zoom wants to work for me this morning.
Oh, great.
Yes, I'm Elizabeth Kopp, Community Engagement Manager with Girl Scouts Virginia Skyline. I'm very accustomed to Zoom not liking to work at first thing in the morning. I work remotely from home and cover many areas, including Halifax County for our local Girl Scout Council. And I put something in the chat log. It's very exciting right now through March 1st. The girls kindergarten up can join Girl Scouts Virginia Skyline for free. And I didn't put it in the chat log, but I like to say late breaking news. Our pre-K, our rising kindergartners will be able to join Girl Scouts actually across the country, starting April 1st in our local Girl Scout Council, Girl Scouts Virginia Skyline, for the first 2 weeks of April, April 1st to 15th. We'll be offering free membership to those rising kindergartners, our littlest leaders who can get a jump start on Girl Scouts before even kindergarten. So that's an exciting thing right now to tell people. Thanks.
Yeah, that's awesome. Thanks so much for sharing.
Yeah, no problem. Glad I could share.
Let's definitely connect because we want to build and support youth in our area any way we can. So thank you so much. All right. Just pausing real quick before we keep going on the agenda. Anyone else online that I hopped over or didn't give an opportunity to introduce themselves? All right. So moving right along. Again, the minutes from last meeting, our January 15th meeting, on the screen. Or I think 18th, today's 15th, so it's 18th, my apologies.
some good looking minutes.
They are some good looking minutes.
Just want to say.
Shout out to Keenan, who so diligently works to make sure that.
No, don't say that.
No, truly though, Keenan does a lot behind the scenes that she doesn't want folks to know.
Shh, I don't. Shh.
Oh, okay.
Hire somebody to type on.
I know.
Okay. Okay, so at this time, does anyone have any questions before we call for a motion? Seeing nothing in the chat and hearing nothing in the room, can we get a motion for approval for our January minutes?
I'll motion to approve. This is Catherine Maloney.
Okay, can we get a second?
So, Stephen Wilson.
Okay.
All right, noted.
Okay, thank you. All right, Will's here, great. So meeting minutes approved from last in January, so I'll stop sharing that. All right, so moving right along, I want to go ahead and I'm excited that we have a guest speaker, Everett from the Community Housing Partners. For those of you who aren't aware, I'm sure Everett will get further into it, but Community Housing Partners does a lot of great work, especially in the more rural areas of our state, to make sure folks have access to safe, affordable housing, to make sure all of their safe, affordable housing meets industry quality standards, and that, you know, some of the most vulnerable Virginians have access to good homes. But I'll from there, I'll turn it over to Everett and let you go ahead and pull up your screen. And thank you so much.
Sorry, my mute bar moved over to another screen. I can't find how to talk. Thank you all. Really happy to be here. I have done probably over 100 presentations since I've started with CHP, and I get excited for every single one of them. And I'm hoping by the end of this, you'll see why, because there's a lot of really powerful programs helping our neighbors who really need it most, particularly around making their homes healthier, safer, more energy efficient. So I think I have 20 minutes. Is that about right? Yeah. Okay. I'm one who's good with having you folks jump in and ask questions as we go. I just find that easier, but I'll let you know what we're going to talk about. I used to teach public speaking at James Madison University, and I always tell students it's important to tell your audience where you're going, so they've got a benchmark for when this thing is going to be over. But I appreciate you all tuning in, staying with. I want to start just by hearing kind of generally from folks what comes to your mind when you think of weatherization or energy efficiency. What sorts of things pop in your head when you hear those terms? That'll help let me know how we're diving in here. Feel free to just popcorn it. What comes to mind?
Insulation and windows.
Insulation windows, okay.
I think of old windows and a breeze coming through.
Windows and a breeze. Other folks, what do you think of when you think of energy efficiency or weatherization?
Energy efficient appliances.
Mm-hmm.
Monitoring equipment that lets you tell you where heat is escaping or cool is escaping.
Yeah, right on. Well, good.
Lower bills. I
Lower
was just gonna
bills.
say that, yes.
There we go. I was wondering who's going to bring that up. Yeah, we'll hit that for sure. Well, good. So appreciate you all sharing. Again, I'm Everett. I help lead outreach and community partnerships for CHP Energy Solutions. Goal for today, we're going to talk a little about who CHP is. We're going to look at the need. I think that's a good place to start. What's kind of prompting the funding that's coming federal, state, utility to support our neighbors in this area. And then we're going to look at the programs, what they offer, and then of course take a look at eligibility and the general process. And again, feel free to jump in with some questions here. Want to make sure we're sharing well. Screen move on your side. Let's get some nods that'll tell me we're rocking along here. Cool. Awesome. So CHP was founded in the mid-70s in Christiansburg, Virginia. Nonprofit with a mission of creating homes and communities that are healthy, sustainable, and affordable. We do that through three main divisions. As noted, we're known throughout the East Coast for affordable housing, development, preservation, powerful resident services, and homeownership programs. Today, though, I'm going to focus on energy solutions. That's the division I'm in and the most abreast with what we do. And Energy Solutions is the largest weatherization provider in the state of Virginia. We'll jump into what exactly we're doing there. So on the Energy Solutions side, we have been implementing the Weatherization Assistance Program. This is a federal program. And we've been doing that since our founding in the 70s. The program is that old as well. Really with the goal of reducing energy burden for households. So these are federal funds that come through the state DHCD and then distributes them to about a dozen providers, including CHP. On the utility side, we've been implementing or contracting with utility programs that are also designed to help improve energy efficiency for electric and gas customers. A lot of this is coming from legislative push at the state level, kind of making sure utilities are providing opportunities and programs for their customers to save money on their bills and to improve the efficiency of their homes. And then we have a nationally recognized training center in Christiansburg. We also just opened one in Baltimore, and we serve out of Atlanta too. Really designed to help train the network across the US, but a lot here on the East Coast as well in building science and energy efficiency and weatherization. So our energy auditors, weatherization technicians are running through that training center to learn more about these programs and how to do them. Showing you a map here, give you a sense of where we're serving. So the dark blue is the territories that the state has designated CHP to be the provider for. And so you're going to see that includes 4 counties there near you all, Mecklenburg, Brunswick, Lunenburg, and Nottoway. We began serving those 4 counties in 2022. They were formerly served by Telamon. We serve New River Valley and then the big chunk up near where I am, Central North Virginia. And actually now, as of this month, DHCD selected CHP to serve the Virginia Beach area as well. So let's start with the need. I think for you all, this is not going to feel like terribly new information, but it's a really important place to start. And really, we're looking at these intersecting challenges, right, of health, housing, and energy. And we know that about a quarter of Americans face a high energy burden. That means they're paying more for their energy than really is affordable to them. And that number jumps to 60% when we're looking at our low-income neighbors. In Virginia, we know that about a third of folks are making really tough decisions month to month about what to pay for. We've got daycare, we've got medical bills, food, and utility bills. And so we know there's energy burden on that side. We also know there's just challenges with our housing, especially those folks who are in older housing, manufactured or mobile homes. They're seeing these challenges as well. And I included a few pictures there that I asked our energy auditors to send me, just kind of the stuff they find in homes. And you don't need to be an HVAC expert to kind of get some of this, I promise. But that first picture there is a disconnected supply line. So that would be the box that's sending the either heated or cooled air to above where it needs to go into the house. That is completely disconnected. So for that family, that means they're not comfortable at all. And their bill is going to be astronomical because they're basically heating and cooling their crawl space. It's not getting up to their house. Second picture there, we've got very likely asbestos wrapped duct. We're looking at health concerns there. Third and fourth picture, we're looking at a major propane leak there in the third photo and flame rollout from an oil furnace there on the fourth. And our team routinely finds these health and safety challenges, as well as just inefficiency challenges there too. All right, so we've got these intersecting challenges. We're, of course, not the silver bullet. We're not the one-all be-all solution, but helps give you a sense of why this funding has been increasing at the federal level, why we're seeing it at the state level, why we're seeing utility programs increase their investments here too. It's a big need. We're looking at preserving housing stock. We're looking at health concerns in our homes. We're looking at addressing energy burden. Before I jump into what we do, eligibility in the process, any questions on those pieces, who CHP is and kind of the needs that are prompting this? Okay, we'll keep rolling then. So let's look at weatherization and energy efficiency. You all hit on some of this. And really the goal here, increase the energy efficiency of homes, decrease the energy bills and the energy burden for the folks that live there. On the weatherization side, we're looking at kind of 5 core pieces here. The first is what we call base load measures, reducing just the energy demand of the home overall. This can be done through things like LED light bulbs, faucet aerators to reduce hot water draw, just to lower the bill kind of right off the bat. LED light bulbs, if you don't have them in your own home, they pay themselves off typically in a few months. Second, we're looking at insulation, air sealing, duct sealing. Not terribly exciting stuff, and it's improvements that often clients don't even really see. But we know most homes are under insulated, and a lot of that loss is happening because air is flowing and heat is being lost underneath and then out through the top. So we will blow insulation in attics, sidewalls underneath the home, as well as seal up the duct system and air leakage around doors and windows. We're looking at repair or replacement of inefficient heating and cooling systems. This tends to be the bigger ticket items. Installation of a new heat pump, replacement of an oil furnace, general tune-up to make sure things are working. We're looking at safety conditions, carbon monoxide poisoning that can happen inside homes, fire hazards, lead, asbestos. We're checking things like that. And of course, we got to look at indoor air quality. As we seal up a home, the bills go down. That means there's less air circulation, air exchanges that are happening in that home. We got to make sure it's mechanically ventilated, that fresh air is coming in and the air quality is good. That's the base for weatherization kind of energy efficiency programs. Additionally, at the state level, we have access to a program called WDR. It is funded through Virginia's participation in more acronyms, the Regional Greenhouse Gas Initiative, or RGGI. Virginia joined that about 1.5 years, 2 years ago. That's provided tens of millions of dollars for us to actually do more home repair type work. And the goal here really is to keep homes from being deferred. So historically, we would go to, say, a mobile home outside of South Hill, and there would be holes in the roof. We historically were not able to serve that home. We'd have to defer them. We don't have funding for roof repair. So that house kind of most in need was getting left out. With Virginia joining RGGI through WDR, we're able to replace that roof and do some significant other measures, electrical improvements, major HVAC upgrades, plumbing, environmental remediation, and more. The current administration is seeking to pull us out of RGGI. It's currently in the courts, so future there is still kind of unknown for us. But we do have access to those funds right now, and we plan to keep using them.
How often in this area, like Brunswick, Lunenburg, Mecklenburg, are you seeing WDR referrals? Like what's the percentage, do you know?
Yeah, so before RGGI, the stat across the network, so including other providers, was about 1 in 5 homes were being deferred. Depending on the area, we're seeing that over 50%. And again, right now, we're deferring probably under 8 a year. I mean, it has to be really, really bad stuff, a hoarding situation or something else that we just can't address. So that number has gone down tremendously with that funding. But it's at least 1 in 5 can trend over 50% or higher, depending on the area and the housing stock.
So you don't have stats area specifically, like how much goes into the weather reserve deferral program and then has to go into WAP or?
Yeah, so I don't have those in front of me for like the Southside area. But I could send them to you if you're curious. Happy to do that. And that we'll take a look at process, right? The kind of double-edged sword there is that when a household needs WDR, it extends the timeline for service for them, with the benefit of we're able to look at things like roofs and electrical upgrades and that sort of thing. But yeah, I could definitely circle with our team and let you know what we're seeing in your area.
I made a note to write an email between the two of y'all. Okay.
Any other questions on sort of what these programs are doing, the measures, the upgrades themselves?
Let me ask this, is WDR allowed for like windows and stuff like that, or is that still off the table?
Yeah, good question. It can. The thing with Windows that trips up a lot of folks when they think of weatherization, interestingly, Windows come to mind. Oftentimes when we go in to do an energy audit, windows are not actually where a lot of the energy loss is happening. And that's because of the stack effect in your home. As heat rises, thinking of pressure in your home, that middle layer where windows are is not often where that air loss or heat loss is happening. So there are cases where we repair windows or replace them. It's typically because they are broken, not necessarily because they're a little old. But we have used WDR funding to do that for homes. Good question. So CHP here, 25 programs, 120 staff. Our goal when folks apply is to check them across programs to see what we can qualify them for. So we'll take a look at how you qualify in terms of income. But our goal really, especially with community partners, is not to try to make you all experts in the qualifications across 25 different programs. We have a whole intake team that can do that. So for you all, we're looking at do you have households that are in need, families, clients, members, residents? we'll check them across programs. So we serve kind of like an umbrella for that case. So let's look at eligibility. So really cool here, we're serving homeowners and renters. Renters are eligible for these programs, which is really, really cool. We will qualify on the tenant's income, not the landlord's. And there, of course, is no cost to the tenant, no cost to the homeowner, no cost to the landlord. We will need the landlord sign off to, of course, make improvements to their property at no cost to them. So homeowners and renters eligible here. We're serving numerous home types, stick-built or site-built homes, your traditional single-family home. Townhomes are eligible. Mobile and manufactured homes are eligible. Often a housing stock that gets kind of left out of a lot of programs like this. We also do a lot of multifamily housing across Virginia. Eligible too, we work with property managers and owners directly in that case to serve the entire property. And generally here, we're looking at low to moderate income households. So 60% state median income for weatherization is the income limit. Family of 4, that's 72,000 some a year. We can bump up to AMI in high income areas. That's mainly in Northern Virginia. And there are some increased qualifiers or automatic qualifiers, particularly if there's someone in the home 60 and older, if there's someone in the home receiving TANF, SSI, energy assistance. So again, we serve as kind of the umbrella. So
would custodian please go to Miss King's room 25 for
Sorry, I did not catch that. Do you mind saying that again? All right, Jamie, jump in again if you need. So 60% state, so 72,000 a year, family of 4. Again, we've got the income limits on our website. But if they don't qualify for federal weatherization, again, we're going to see if we can qualify them for a utility program. And right now what's happening is we work to blend those programs so we can maximize investment into one household. On the federal side, when a home's weatherized, we can't come back for 15 years. So when we're there, we want to make sure we are putting as much investment into that home as we can through multiple programs. It's really cool. All right, we're going to take a look at intake, hear from a client of ours named Don, and then we'll be wrapped up here on our side. So admittedly, this is a very simplified process map here. But on the front end, we're looking at an initial program screening. Folks can call our 888 number. They can hop on our website, fill out an online form. That's going to tell us where they are, who's in the house, what's the income look like, what are their utility providers. From there, our team will either mail out or email out the necessary applications or documents that that family needs to submit. Once that family's approved, they go on our list for an energy audit. That is a required piece of the program. We can't do any improvements without getting in there and actually testing air leakage, insulation levels, what's going on with appliances and heating and cooling. And so an auditor from our team is going to go do that. Typically, there's about a 4 to 8 month wait period for auditors from that approval. That time's going down. We've doubled our auditing team in the last year and a half. So we're moving folks a little quicker through that audit stage. But someone from our team is going to go out, spend about 4 hours or so going through that whole home. From there, we get a scope of work. What can we do based on the funding we have and the needs of that specific home? You see the dotted arrow down there. We might need to do some what we call weatherization readiness, home repair remediation. That's that WDR funding, or working with a community partner. We do that too. Once that home's good to go, in some cases they are good to go from that audit, we send them over and that home gets weatherized. So all in all, we're shooting for under a year here from very, very start to finish. Can be a lot quicker based on how soon we get documents, how soon we get an energy audit out there. Depends on the needs of the home. On average for a home, you're looking at $8,000 to $10,000 of investment, and that goes up when we're looking at WDR. We've done some really major improvements for folks to include roof, cleaning up sewage in a basement for a home in Elkton, and other challenges. So really powerful funding here. We're not the emergency provider. So important thing for your folks to know, right? You get approved, we're not gonna be out there next week. This program is kind of designed for the long game. How do we lower those bills, increase that comfort, month after month after month after month for that household? Any questions on intake and process? We'll jump over to hear from Mr. Dunnick here. So lots of clients we can share about. One of the favorite parts of my job is being able to connect with folks and hear about what this work has meant for them. So realize you guys are down south. We're heading up to Fairfax here. This is Mr. Don Dunnick. He lives in the home his parents bought back in 1951. He inherited it before the metro tracks were put in, he said. And he came to us with utility bills that were $600 a month. So that was about more than half of his income from Social Security and disability. So really, really challenging here. He had, as you can read there, holes in his roof, really ancient heating system. So we were able to, with WDR, got him approved. We were able to put on a new roof, put in a high efficiency heat pump, and several other repairs and weatherization improvements to really slash that bill for Don and for him, really allowing him to keep living in the home that he's living in, that he wanted to stay in. He had friends encouraging him to just leave, and he wanted to be there. So this program was a big part of making sure that can happen, which is really cool. I've got an audio clip. It's 15 seconds from an interview he did with WAMU, the NPR affiliate up north. I just think it's really cool to hear from him what, in this case, he's talking about Reggie, that WDR funding has meant for him. I think I've selected share audio. I might need to double check that now that I'm thinking of it. Let's just try it and you tell him thumbs up if you can hear it, please.
As for Donald Dunnick, he gets a little choked up when he talks about how Reggie helped him stay in his home.
A lot of people kind of look at these programs as a handout. Really, it's not.
It's a win-win, he says.
Because it saves energy, it allowed me to keep my home, and it puts people to work.
What I think is super cool there is Don is like recognizing the benefit this has on like him, just him and his home. And he's connecting it to job creation in the state, to lowering emissions and pollution for all of us, to reducing energy burden on the grid. And he's like choking up, sharing about this, being on like the receiving end of investments like this. Yeah, really powerful stuff. That's a lot. That's what I have for you. My job on our team, I help lead outreach and partnerships. So, this year we've got a lot of cool stuff from, door-to-door efforts in mobile home parks in Fairfax. I'm working with community groups here in Central Virginia, helping them sign up their clients and members. We do events, we do mailings, lots of cool stuff we do, and I get really excited about doing that kind of thing. We know that for programs like this, trust is a challenge. So you folks on this call are the folks that have trust with your communities. They know you, they go to you. CHP is likely a nonprofit they've never heard of. So we know that this kind of work is really important for building that trust and helping people, understand, particularly our older adults. This is not a scam. This is a federal program with state funding and utility funding, and we all win when you participate. So I've got my contact info there. I'll send you all an English-Spanish flyer, at least to start, so you've got something. And then feel free to reach out to me with any other questions and ideas. And then the number for our intake team, this is the go-to if you got anyone interested in the program. That 888 number is the best one to call. They can also email us there at that CHP Energy Solutions email. So happy to answer any other questions that you all have. And again, really appreciate your time this morning.
Thank you.
Thank you, Everett. Just want to pause really quickly for any questions, comments, thoughts.
Did he say this covers all areas of Virginia or just specifically certain areas?
His company specific areas, but the program is all over Virginia.
Okay, that's what I wondered. Okay.
Yep. And if you go on our website, actually on our weatherization page, we've got a map of Virginia and you can see who your weatherization provider is. Again, we're the largest. We cover the most territory, but every county in the country has a weatherization provider. So if you come through us, we'll either connect you with your weatherization provider. Utilities, of course, there's overlap. So Dominion's running programs, Columbia Gas has programs, Appalachian Power has programs here. And the goal is to just see what you qualify for. So yeah, every county's got a weatherization provider.
And then Everett, I know you said that SSI folks were on the, to be prioritized list. Does that also include like SSDI or folks on VA benefits, or is that solely for the SSI program?
I don't know the reason for this, but it is just SSI. And that's for an automatic eligibility. So if there's one person in the home on SSI, we actually don't even look at income for the household. So in the case where someone doesn't have SSI, we'll just look at who's in the household, what are the adults working and what's their income. Good question.
Is that correct? It's not when you retire with a disability.
That's SSDI.
Thank you.
Yeah.
Yeah, we love acronyms in this work.
Yeah. Yes, we do. All right. Well, thank you so much, Everett. Thank you for being here and for your presentation. Definitely, I'm sure be in touch. And so
Happy to send this presentation out. I'll send it to Keenan and then I'll include our flyer there so you've got it. Feel free to reach out. And again, thank you all for your time. Appreciate it.
all right, folks, rolling right along, I'll pull up our agenda for this week. Let's see what's today. Today is the 15th. I hope you all had a great Valentine's Day. I don't think I've said that yet, but if
This is Angela. Hey, dear.
all right, so I know we've had a couple of folks come in since we kind of started, so I wanted to pause real quick and give anybody who wanted to say hello, who they are, before we give the rest of our updates. You're also, please, as you.
We're gonna need to check with Beth and Paula and see about their.
Liam, I was just going to say good morning. It's Chris Pennington from Resilient Pathways. I'm sorry I joined late.
Chris, I can hear you. Kathy Tuthill from Rivermont Schools. And again, I apologize for joining late as well. I had a previous meeting before this.
No worries. Thanks for being here today. All right. Here in kind of a lull, I'm just going to keep going. But again, put your name, the entity you represent in the chat, please. If you need to stop me at any point, just let me know. But for the sake of time, I'm just going to roll on a little bit. The next thing on our agenda today is our leadership team meeting the Southside Wellness Coalition's leadership team is going to have our first leadership retreat this Saturday, February 17th. It's going to be a day-long retreat. It's going to be led by Paul Short from Face to Face Space. Paul is a motivational speaker, life coach, business coach, and just kind of all over organizational consultant. He's going to come down and help us, unify ourselves a bit as a team, work on common goals, and really give us some directives, hopefully, for 2024. And then we're going to work on a little bit in the afternoon, work with the Ticken and making sure that we are aligned, and the Southside Wellness Coalition and the Ticken are supporting each other and working in unison. And then we also, are going to do some fun activities and some just general leadership and team building. And so pretty excited about that. Keenan, did you want to add in? Did I miss anything?
No,
Or anything? Okay.
I'm super excited. Everybody needs to roll in here and start having some snacks and breakfast at 9. It's gonna be a great day.
Yeah, so we're gonna keep you all day, but we are gonna feed you, so, we try to be as kind as we can. Hold on, I see some things in the chat, so I'm just gonna read that real quick. Okay, I think it's just folks introducing themselves. All right, any questions about the leadership team retreat before I turn it over? All right, here in a lull, I'm gonna move on. Next up, we have our veteran outreach on February 29th. This is gonna be in Clarksville. I think as of this morning, I heard about 60 folks approximately. We're looking to be there, so wanted to see if any of our folks from the VA, Allison, I saw you on the call. Anything else you wanted to add? Just in terms of the needs assessment or anything you needed from us?
Hey, this is Allison. That's awesome. 60 people that's amazing. You guys have been doing a really great job of getting the word out in the community, obviously. So, that is wonderful. I just wanted to kind of touch base with you guys. I think from myself and Angela's end, we're good. Like we'll bring all of the paper and supplies that we need for the assessment, the needs assessment that we're going to be doing. Just had wanted to touch base with you guys. I know that Keenan was thinking about kind of food options, and so if there's any support that we could lend there, was just curious.
We've contracted with a local veteran-owned catering service.
Awesome.
So Mr. Dennis Damians is gonna be providing a dinner. So he specializes in Southside barbecue, so it's gonna be a barbecue, 2 sides, a roll, and a dessert with some tea and lemonade. He's gonna be there, meet Catherine and I a few hours early, set up. So we are projecting 50 to 60 people. But we certainly will continue to advertise, remind, it's 2 weeks from today. We're blasting it on Facebook. We've got it advertised in the 2 local Mecklenburg County newspapers on a weekly basis, every issue they have. We still feel like we would love to have more folks. So those of you in the room, I printed the color flyers. If you could please post that. I'm not able to travel around town and post flyers up, but you can as a local partner. I'll also email everybody that's on the call today. It's down there in the share.
And if anybody wants can we blast out to the list, the JPEG?
Yes,
PNG
absolutely.
And the PDFs in case anybody wants that. And it just as a reminder, you don't have to be a veteran. Veterans may touch your life. You might have a friend that you've seen struggle or whatever the case may be, that you want to participate because you have firsthand, secondhand knowledge of, the struggles that people are going through in our community. So don't feel you have to be a veteran to participate. There is a UR code or is it a UR?
Yeah, it's a QR code.
QR code, sorry, my acronyms, getting those mixed up again today. There's a QR code, please sign up because we do want to have a good accurate count on who's attending. Even if you're a coalition member, please sign up so that we know that you intend to come.
Correct. And I just dropped the flyer into the chat, the most recent one that I had from you guys, if that's okay. So if anybody wants to access that PDF, it's right there. And then I know were we still gonna have some people tabling?
Yes, we've got some local folks. We've got a gentleman from the VFW who's doing a table about talking to veterans about the VFW. There's a lady coming from South Hill, who I know Sherry and I both had conversations with from Veteran Services. She's gonna be tabling. That's what I have so far. So
Okay.
but anybody who registers, who's representing a veteran group, I have offered them the opportunity to table. But I've only got 2 definites, but there is a room. Catherine and I went through the VFW last night. When you come into the first greeting area, there isn't a table, an area there is set up about 5 or 6 tables. So we'll be doing that. We also plan to have locking medication boxes there. Also be a table for you to share items from the VA. And then when you come into the larger room, we're setting it up for the dinner area. And then we're setting up 2 screens, a projector, and a laptop so that you guys will be able to do your presentation with some technology.
Perfect. Okay. That's wonderful. And we'll bring our laptops too. Thank you guys so much. And it sounds like it's going to be a really awesome event. I'm excited.
Yeah, thank you all. A special shout out to Catherine for really coordinating a lot of that with the VA. So thank you so much,
You're
Catherine,
welcome.
for the work you did on
They
that.
have a piece of my heart, so.
For the VFWs.
Yep.
Yeah, thank you.
And they were sharing last night that they hope for a wonderful turnout because they want our efforts and these opportunities to talk to local veterans to continue. And so some of the gentlemen we spoke last night said that after this particular event, they're interested in talking about next steps.
That is wonderful. Definitely look forward to doing that with them. And I know I'll probably, Angela and I will probably chat with you guys offline, prior to the day of, but definitely getting excited. The outreach has clearly been top notch. So kudos to everybody that's been trying to outreach veterans and other SMVF in the community to get them to turn out.
Yeah.
Yeah.
Yeah, fingers crossed that it's an awesome
Yes.
turnout. And just remember, I know it's been stated, thank you, Allison, for putting the flyer in the chat. I know that we are also working on getting that updated. But if you do plan to attend, please register. Even if you are a coalition member or part of the leadership team, please register just so, since we are getting, dinner and we just want to have a count of who's going to be in the room. Please make sure you do that. Any questions before we move on?
Oh, that, yeah, okay.
All right, well, thank you so much, everyone who's working on the veteran outreach, Allison and Angela and their team, our team. Next up, we have an update from Engaging Halifax. Shannon, are you going to be providing an update today?
I really didn't know I was going to, but I'll be happy to. Engaging Halifax tonight, we are actually having our very first topic group meeting of people who are in recovery. And it will be tonight at the Higher Education Center in Halifax. And we are still looking for people in our other groups, our provider group, and also in our government officials group. And we are doing very well on recruitment, but we would like to get a little farther along so that we can get those topic groups started. And if anyone has any questions, they could feel free to contact me or you or Keenan, who I'm very glad to see you vertical and healthy, Liam. But Engaging Halifax is going forward very well, and our sister project is that's going on behind the scenes is actually going very well too. So we're hoping that we can get some good information and good input about what we need most in Halifax, and actually have an audience of government officials that are listening to it and will be using the opioid funds to go forward with it. So that's our goal. Thank you.
That they needed additional law enforcement representation, they needed additional first responder representation, anyone that is involved in a rescue squad, an EMS team, anyone connected to providing services for calls. And something to mention as well is that folks that are participating in these topic discussions are receiving a stipend for their time. So that's important to share if you're letting folks know. If they feel they're in any way impacted by the opioid epidemic and they live in Halifax County, they qualify. It's simply just that, and being willing to come to the Southern Virginia Higher Education Center periodically to have discussions about the issue and how it's impacting Halifax County. Am I saying that
So
right?
not working in Halifax, like if one of these professionals worked there but didn't live in Halifax, or how does that work?
Working is also is also perfectly okay, and I believe that there are 6 topic group meetings in total.
Liam, if you're speaking, I can't hear you.
Sometimes you have to shout for that out.
Okay, can you hear me now?
Yes.
Okay, I turned it over to you for the
Oh.
continuum.
I assumed. So yeah, just we had a COC meeting. COC, for those who don't know, is Continuum of Care. The COC has 3 main goals: to prevent homelessness, to shorten the length of time that people are homeless when it does occur, and to decrease recidivism. As a reminder, we had our point in time count on January the 24th. That is where we get most of our funding. It's a sort of a snapshot of who in the community is homeless at that time. We also discussed funding. Specifically, Tri-County is almost out of funding. So once our emergency shelter money runs out, we will not be able to help anyone who is homeless until we receive more funds. So that is kind of a ticking clock for the community. There's very little resources available other than Tri-County, and we're very short on funds. That being said, one of the things we did discuss is the possibility, what it would look like to have an area homeless shelter. Where would we put it? How would we fund it? How would we staff it? So that's something that we kind of want everybody to just be thinking about. If anyone has any ideas or thoughts on that, please let me know. But that was the gist of our meeting last week.
Was there any discussion of what county you all
Not really. It's still sort of early days, and that's another reason we're kind of asking for input, because obviously for such a large service area, where do we put it? Where it's most easily accessible for the most amount of people, and we're not really sure. That's kind of what we're still brainstorming.
Do you have stats yet on that point in time and what county, like?
We don't yet. We're still compiling the data, but we're very close. It's due pretty soon, so we should have more like hard numbers on exactly how it went. I do know that when we went out as teams, we did find 5 people in Charlotte County. There was one in Brunswick County. There was one in Halifax County. That doesn't count the ones that like law enforcement reported to us, or that we already had an established relationship with. Those are just the ones that we found on the boots on the ground that evening.
Wow. 5 in Charlotte County?
And none in Mecklenburg. I was on the Mecklenburg team and we didn't find anyone, but we know they're there.
Yeah. Thanks.
Yeah, thank you. And thank you for the count. For folks that don't know what the point in time count is, it is quite literally a boots on the ground. Folks from local volunteers and folks from our local agencies go around and try to find folks experiencing street homelessness or sleeping in places that aren't meant for human habitation. And so they spend quite a bit of their free time in the dark and the cold with flashlights sometimes and working with local law enforcement. And so it's quite the task. And the reporting on the back end is also quite the task. So thanks to everybody who was involved in that and did that on the back end. Any other questions for the continuum of care before we do the Sakova update? Okay. All right, do you have a Sakova update?
Unfortunately, not really. I had a doctor's appointment that morning. I knew that, or I had assumed I would be out in plenty of time, but the appointment turned into labs and x-rays. I have not received a transcript or a copy of it or a video of the meeting at this point. I can tell you that there's an active spreadsheet tracking right now on bills going through the General Assembly, and that's a big focal point this time of year in Sakova. They'll track everything from substance misuse, anything to do with gambling, alcohol, tobacco, and the likes. I even saw one in there that's somebody's introduced about recovery high schools, which I find extremely interesting. But I hope to have a little better report for you next month.
Okay, awesome. And for the folks online or anyone in the room, if you're interested in that spreadsheet that Stephen mentioned, that's tracking the General Assembly bills, that's Sakova is tracking in the General Assembly, excuse me. We can get that sent out to you and include that with the notes too, probably. And then the next Sakova meeting is March 4th, right?
Correct.
I think so. Okay, March 4th. So we'll know more for you then. Thank you, Stephen. All right, and then next on the agenda, we have our logo update from Sarah. I didn't see her on the call.
No, she's not here today. She's doing a deep dive into creating, based on the feedback at the last meeting. I talked to her yesterday. She's recreating a number of different logos, based on feedback that are completely different than the ones we had before. So she plans to have that ready by the leadership team meeting this Saturday and then to share out at the next meeting.
Perfect.
Great. But she feels like maybe there should be some consensus moving forward, so we don't go in 9 different directions.
Did we shelve all the other ones or did we just want to see?
No, they're all in that continuum of PowerPoint. So we have all the original ideas, but she's building it out. But based on feedback last time about some liking some of the elements of the different logos, other folks not liking elements, she's trying to create some more options.
Gotcha. Thank you.
And I think she's gonna lean on the leadership team to kind of narrow it down so that leadership can vote, by early April.
Okay, awesome. Rock and roll. All right, so next up, we have our leadership team updates. So I know I saw Chris, I think everybody that attended CADCA is on the call. Just so the folks who aren't aware, CADCA is a national conference. It was held in National Harbor this year up in Maryland. It's sponsored by SAMHSA and the DEA and a whole lot of other prevention professionals and substance misuse professionals throughout the nation. It is a nationwide conference. And so folks from coalitions across the nation get together and hear best practice standards and innovative ideas, have workshops and really get to learn a lot about what's going on in terms of prevention and, tackling substance misuse across the nation. Additionally, we got the opportunity to meet with some of our representatives. So we got to meet with Bob Good in the House, and then we got to meet with Senator Mark Warren as well. We'll represent a staff member for Senator Mark Warren, and so discuss some of the things that we're seeing here in the Southside that they may not have been aware of or always have the most up-to-date information on. So that was a pretty exciting opportunity, I thought. But overall, I thought CADCA was incredibly informative. I'm excited that 4 members of the leadership team could go and that we can all get together and kind of put our heads together and think about things strategically as we move further into 2024. But yeah, I wanna invite you guys, Will, Christine, Elena, if y'all wanna share anything about your experience, now, please do.
It was a great conference. Capitol Hill Day was definitely one of the highlights of that experience, and actually having our rural Virginia voice heard a little bit, at least being able to express our concerns and, maybe highlight things that are not always on the radar, for rural areas being, advocated for. I have a lot of, great ideas that, just came out of that conference, of maybe things that we can do in our community to spearhead prevention programs. So I'm excited to have our leadership summit and see where that goes.
And I just wanted to echo that. We learned so much. We were introduced to some new ideas. For example, Will, who's, I don't think he's here, but he tried on some glasses that make you feel and see as though you were intoxicated. And we're hoping that we can kind of use some tools like that to show why you shouldn't be driving if you're intoxicated, for example, or operating heavy machinery, or all the dangerous things you shouldn't be doing. Another thing we got to discuss with with Congressman Good is data collection, and how it's very much lacking in this area. If they don't know there's a problem, they can't address it, and they don't have the information to know what the problems are here. So we're hoping that we can work on that as well.
And okay, thank y'all. I did see that Will hopped off, so won't share for him, but I will share that for me personally, seeing Will in the impairment glasses was also one of the highlights of my CADCA conference.
Got video?
No, but there are photos. There is no record. All right. And so next up, and the last thing before we get to our training and announcements, just want to open the floor for any folks here to share any news they have within your agency or organization or representative entity.
Well, I recently attended an open house here. It's in Scottsburg for a crisis stabilization center. I did put it in the chat at the beginning of the meeting, but I'll go ahead and share the flyer again. Essentially, it exists so that people who would normally go to the ER for a psychiatric emergency can go here instead, which is much less traumatic. And their hope is that they can stabilize the person to the point where they may not need inpatient care. They may just need somebody to talk to for a few minutes, some kind of medication stabilization, which they are able to do. They also have virtual reality glasses. I did a 5-minute breathing exercise at a lake house. So they have different kind of tools, and a lot of it is in the flyer. They're also, you can walk up, like you can just drive up to the door. You don't have to call ahead, although they do ask that you do. They're also advising law enforcement and EMS to take people directly there that would normally be going to the ER. And I'm sure most of us are aware that the ER can be a very traumatic place for a person who's having a psychiatric emergency. And if it determines that they need to be inpatient, they could sit there for several days before a bed opens up for them, which just compounds the trauma. So hopefully this is the kind of place that can prevent a lot of that.
And the flyer, she dropped the flyer in the chat box.
Yes.
Okay, I can put that flyer up on the screen, yeah.
In the chat box or not.
Let's see.
Oh, is that fee-based?
Peaceful Pathways. Yeah, it's Peaceful Pathways in Scottsburg.
So do they do work on a sliding scale, Alana? Do you know?
I'm not sure about the sliding scale. She was saying that they accept all major insurances, and that they're hoping to continue to expand, but right now they do have, the person who's running it is a psychiatric nurse practitioner, so she is able to prescribe medication, and then she has 2 counselors that are working with her remotely.
There we go.
And I just scanned the flyer I have. It may not be the best looking thing.
And then we can include this in our blast too, so folks who attended the meeting can have, or folks who didn't get to attend the meeting can have it too.
Yeah, and with, I can email, Ms. Medley, make sure we have her permission, we can put it in our monthly newsletter next month.
Cool.
She does want it. She wants the community to know about it. She serves all surrounding counties. If you show up, she's going to help you. That's what she told me.
So she covers, what counties did you say in Virginia?
She said all counties. Whoever shows up is going to get help. Is what she said.
Nice.
All right. Thank you.
Yeah.
We'll definitely make sure that we get that information out there. That's
Yeah, I'll
awesome.
get it to our newsletter.
Any other member updates?
Can I just share out that in Chase City, we will be hosting an ACEs training on February 22nd at Resilient Pathways, 6 p.m. at night. We do have a online registration. Keenan, you don't by chance have that handy, do you?
Liam's got it in there under shared documents.
Oh. Okay. So just, adding that to, didn't realize it was down there, but just, welcoming anyone, or if you know anyone in an organization or in your community that would benefit from it. Thank you.
1 hour version.
Okay.
Is that the 1 hour version of basic?
Yeah, it'll be a 1 hour version, yes. It'll be what ACEs, we provide a folder of materials about us, along with some additional reading they do afterwards. We'll share a couple of videos. Christine will talk about the services that Resilient Pathways offers, and then there'll be like an open discussion and some snacks. Okay. But designed to be about an hour to an hour and a half, so that, people have the opportunity to stop by, have conversations, but without feeling overwhelmed.
I do have one thing, if nobody else wants to go. Tri-County right now is doing free income taxes for anybody in the area, North Carolina included. We're doing them Fridays in Chase City, Virginia, Charlotte Courthouse, and South Boston, and Saturdays in South Boston. You need an appointment. It is the drop off and intake. So we'll do intake on you, get your information, photocopy it, give you back all the originals. And then we'll do your taxes, quality review them, call you up and you can come pick them up and sign. And we will do this all for free and submit them electronically to the federal government in as many states as are required. And we offer this service to anyone with an AGI, which is an adjusted gross income of $63,000 or less. So great service. You can call 434-575-7916 and request an appointment. I'm the Chase City person every Friday, so come see me or tell people. A lot of our people are elderly, and we're also really specializing in the earned income tax credit and the childhood tax credit, because a lot of people don't take those two credits. About 25% of the people nationally forget to take those. So that's what we're there for. And we're funded out of a small grant by the Virginia Cash Campaign, but the agency funds most of the program with internal funding. So,
Can you send the flyer for that for the next?
I sure
newsletter?
can, yeah.
Okay.
Yep.
All right.
And we're
Just to have
really
something to
pushing
do.
Charlotte Courthouse and Chase City because we just opened those two up last year. South Boston, people know about it. It's been there for over a decade, but the two other places we're seeing a lot of headway. So tell people about it, please. I'll get you a flyer, Keegan.
Yeah,
Yeah, just have something to put in the newsletter.
awesome.
I know we have over, 1,575 people who follow our newsletter on a monthly basis.
Okay,
So,
so do you want a flyer or like a Facebook post? What do you want? Just a flyer, like a PDF?
Yeah, but if you want to give me a Facebook post, Ellen can put it on our Facebook and Instagram as well.
Okay.
That's a great reminder to everybody. Anyone who's a member of the coalition, keep in mind that if your agency, your neighborhood, your church sponsors an event, that we're able to put it in our monthly newsletter, as well as use funding to put it on social media at no cost. That just comes with being a member of the coalition. And then Ellen is always looking for ways to increase traction on our Instagram, our Facebook, and as well as to increase people following the monthly newsletter.
Absolutely, thank you. And just to update on my end, Lean In Project is partnering with Kaleidoscope in Danville or Pennsylvania County, Virginia, to do a community survey for the LGBTQIA+ community in Danville and Pennsylvania County. This survey is pretty broad and covers healthcare, education, employment, living environment, and just general social well-being. For any of the folks in the LGBTQIA+ community. And the survey will hopefully inform Kaleidoscope's 3-year strategic plan moving forward. And so if you know anybody who lives in that catchment area that identifies within the community and may be interested in taking it or wants their voice heard, definitely feel free to reach out to me. My email will be included in the follow-up, but I can also put it in the chat. Email or phone is the best way to get in touch with me. It is a closed survey, so it does have to be shared in order for folks to have access to it. So please do email me or let me know if you know anybody who might be interested. Anyone else? All right. So just a reminder, I know Christine said about it, and we shared that really cool poster, but we do have an ACEs training coming up on February 22nd at Resilient Pathways in Chase City. We also have our community needs assessment with the Clarksville BSW on February 29th. We have our assist class, our next assist class is March 28th and 29th. And then we're gonna be offering virtual revives on March 18th, April 8th, May 6th, and June 10th. They're all gonna be at 4 p.m.
Where's the assist class?
Gonna be here at Southside
Here.
here. And those of you in the room have a flyer, hard copy, you're welcome to take it with you to post up somewhere. You can share it online if you want. Yeah, it's Thursday and Friday, the last Thursday and Friday of March. It's the Applied Suicide Intervention Skills Training, comes breakfast and lunch. It's a 2-day, 16-hour certification and having the skills to talk to someone who's having suicidal ideations. It is here in Clarksville in March. We're also planning one in South Boston in April, but I'm not able to release that yet until we fulfill the folks in this class. So we're trying to offer an assist, if not monthly, if not every other month. Some really good skills, some good soft skills for anyone. You don't have to have any type of special background. It's open to anyone who's interested. And I do still have many available seats in that class.
Okay.
In this one?
Yes, yes. And also to mention, on the table as well, there's a copy of the flyer and it's also on the shared documents that we are participating in the Virginia Young Adult Survey that launched about 2 weeks ago that will run until April 16th. It's a short time window to ask every 18 to 25-year-old that lives in the state of Virginia to answer a 7-minute multiple choice survey about their substance use, attitudes, behaviors, as well as mental health. And at the end of the survey, it asks you if you'd like to have an incentive. Every county in Virginia is offering an incentive. We, as Halifax, Mecklenburg, and Brunswick, are offering a $25 virtual gift card to Amazon. So we cannot actively advertise the $25 gift card. That creates difficulties online with some spam. So the flyers you can see is a generalized flyer from the state that says there may or may not be an incentive, but there is. I'm going to be on SBCC campuses in South Hill, going to be at SBHEC in South Boston. Sarah and I are going to set up a boots on the ground effort to try to get 250 kids who are from our area to respond to this survey by April 16th. I'm gonna put it out, it was in the newsletter, I'm gonna email it out to those of you today, but if you know any young person, 18 to 25, that has 7 minutes to respond to that survey, they get a gift card. They do not complete the survey, obviously don't get the gift card, but we also don't get the information that they answered. It's a text.
You said you're having some of these in person too?
Yes, so that the student, as soon as they finish the survey, it links up to our Survey Monkey. I'm gonna be live on my Survey Monkey, so that Sarah can generate them a gift card right then, on the spot. Which is a way to keep them standing there and finishing the survey. Just to share, we participated 2 years ago, we had less than 80 responses. Of course, it was during COVID. But we reported that 32 young people didn't complete it from our area, and that data was not counted, and that's a huge hit. So we're creating a survey so that, like what happens to us adults, we start something on our phone, and then somebody else, something happens, and we let it go to sleep, and the survey shuts down and blocks us. So you can't go back into it a second time. You have to go to the very end, and that's why we have the incentive locked in there.
Okay,
That's it.
all right, so secret incentive for kids taking the survey.
Secret incentive.
Yeah.
It's not secret. I'm hoping they're gonna text all their friends after that first kid gets that $25.
Exactly.
That should be my free marketing, I hope, at
Yeah.
SBCC. I'm gonna say now, text every single one of your friends that I'm here right now. Come do
Are you
this
going to
survey.
Keysville?
Going to Keysville, going to Alberta, going to South Hill, going to
Talk to
South
Kate?
Boston. I talked to, yes, I love her. I love her. She got me in touch with all the community college reps who had the ability to say, you can come sit on the campus and do that.
Awesome.
Yes, yes. I need to give her a big hug when I see her. Yes. She's fantastic.
All right.
Yeah.
Well, thank you.
Hey, she's just like Catherine.
Oh my gosh.
She's a teeny weeny bit nicer than Catherine. Okay. I'll tell you about my
So
daughter
far.
too. My daughter's a nicer person than me too. I'll say that.
All right, folks, well, just out of respect for y'all's time, the last couple updates I have for you. Our next leadership team meeting, again, is gonna be this Saturday, February 17th, here at the Southside Behavioral Health Administration Building. It's gonna be wrapped into our day-long retreat. Our next meeting for all members for the Southside Wellness Coalition is gonna be our hybrid meeting on March 21st. Again, just gonna begin at 10 a.m. as always. We have we'll send the meeting link out to you. Make sure you register for that. And also make sure you check out our Facebook and our Instagram. Anytime you want to get featured on Facebook or Instagram, send social media posts or anything you have to ksmith@southsidebh.org, or prevention@southsidebh.org. And also, as a member of the coalition, you have access to all of our marketing or not all of our marketing resources, but all of our marketing platforms. And so reach out and let us know if there's anything you'd like us to feature. And then last but not least, make sure you check out our website at bewellsouthside.org for all of our updates and anything we're working on. But I think that's all I have for you today. If you have any questions, comments, concerns, feel free to come off chat real quick. All right, well, otherwise, I'm gonna let y'all run. Thank y'all so much for being here. It's always a pleasure to share this space with you. And thank you for all the work you're doing.
Don't shut me down.
Thanks, everybody.
Thank you, everybody.
Turn off. Go on to adjourn. Yeah, I'll turn it away to register for this.
Oh, yeah.